So hypertrophic cardiomyopathy is one of the more common conditions that we see in cats affecting their heart. And basically what it is, it's a thickening of the heart muscle. So I guess I probably think of it almost like being a muscle-bound bodybuilder, where instead of having nice athletic sort of muscle formation where things work well, they flex well, the heart muscle becomes so thick that it becomes very inefficient with its contraction. So we basically start off with a nice normal sort of heart, and as the condition develops, we basically get a thicker and thicker heart muscle, and we end up with a smaller heart chamber. So we end up with less blood volume actually getting pumped with each contraction because of the decreased volume of the chambers, but also because the muscle isn't contracting effectively, it's also not emptying those chambers very well. And this is the main cause of that aortic thromboembolism that I discussed in an earlier video. Because the blood's not circulating well, it's a bit sluggish, we end up getting some platelet clumping, and that platelet clumping contributes to a clot formation, and that clot then can break off and head down the aorta and cause problems where the aorta branches off to the femoral arteries. So we don't understand a lot about the cause of this. We think it's a genetic condition, and it tends to affect certain breeds such as the Maine Coon. But yeah, at the moment there's really not a lot we can do to prevent this, and it's a very difficult one for us to really know that this condition is developing, because we basically don't hear any changes to the heart sounds until we get quite advanced disease. So the heart sounds are quite normal because it's not creating a leaky valve, we're just getting an inefficient pumping, and a lot of cats compensate for that very well until they develop a blood clot, or until the heart becomes so inefficient that they develop signs of heart failure.